I want to thank the organizers for inviting me to speak to the importance of engaging the patient perspective in this initiative to explore repurposing of drugs in rare cancers such as sarcoma. As research is planned in uncommon diseases, understanding not only the biology of the disease, but also how it impacts and how it manifests itself in the individual is really important to designing relevant and sound clinical research. Sarcoma is a broad group of diseases affecting approximately 1% of all adults diagnosed with cancer and 15% of children with cancer. And within this broad group of sarcomas, there are over 80 different subtypes of sarcoma. And while there are commonalities across the broad group of sarcomas, there also are unique nuances within the different subtypes. So including people with firsthand experience with the disease and planning can really provide important insights and strengthen the research overall. In working with sarcoma patients individually and with sarcoma advocacy groups over the past 20 years, there are some common core priorities and challenges across the subtypes that consistently emerge no matter what our project that we're working on is. When diagnosed with an uncommon disease, having access to a medical team that has experience and understanding of your specific disease can be critically important. Very often, patients will voice the challenge of finding an expert physician and care team, and particularly the challenge of receiving an accurate diagnosis. Sarcomas can be difficult to diagnose, and expert pathology is critical for having that accurate diagnosis, as it really impacts the selection and implementation of the treatment plan. Clearly, this is a #1 priority for patients and their families. Unfortunately, initial therapy may not be effective in all cases, and hence the second priority, having access to improved therapy. Knowing that there are researchers who are exploring new treatments, as well as knowing that there are companies who develop drugs are sufficiently interested in rare cancers like sarcoma, is so important when facing persistent or relentless disease. And lastly, having access to the best treatment no matter where you live or no matter what your resources are is a priority, especially when facing an uncommon disease, because it may be less likely that you'll find that expertise close to home. Fortunately, there are several advocacy groups that provide support and assistance to help patients gain access to expert care. However, travel isn't always feasible for everyone, nor is funding sufficient always to provide for that travel. With this information as foundation, then we really recognize that it's so important to include that patient voice in this repurposing initiative in an important and meaningful ways. And these can include several, as I've listed here for you. They can be of assistance and provide insight in an advisory capacity. They can share patient reports. Almost all of the groups have an online presence or a social media platform for sharing of information. Patients readily will share their experience, their treatments, their outcomes, and some of the groups have really gone on to develop databases to collect the information, providing, and which can be a source of useful preliminary data to advise and provide direction based on real-world patient-derived data. They can also provide information relevant to the specific subtype, those nuances that I mentioned before, as well as confirm commonalities across a broad group of sarcomas in general. They can provide insight into design. They can look at the planned project and say, are there barriers to implementation? Are there ways to overcome those barriers or alter the design such that those barriers are eliminated? They can assist with the selection of patient-reported outcome data elements. For example, we have experience in convening patient focus groups to discuss subtype relevant symptoms related to the disease and treatment, review PRO assessment tools, and this can really be an effective approach to ensuring relevant PROs are selected and included in the research. It can also be helpful in reviewing. It can ensure that patient-friendly language is used for the information that's shared, as well as in the consent form, and they can be really critical to helping to disseminate information, sharing research findings, sharing scientific information with the patient community, and even making them aware that this work and research is being done. These are just a few opportunities for meaningful engagements of the patient voice in research, such as this drug repurposing initiative. While recognizing the importance of developing a collective voice and working together, several sarcoma advocacy groups have joined together to establish coalitions, which present really an excellent portal for connecting with those who can lend their patient voice to initiatives such as this. And two such examples I'm showing here are the Sarcoma Coalition, which was established in 2017. It's a US-based sarcoma advocacy group initiative. And the objectives of the Sarcoma Coalition include the establishment of a collective voice across sarcoma subtypes, as well as their goal of identifying opportunities to leverage their patient perspective collectively. Another initiative is the Sarcoma Patient Euronet, Spain, which was established in 2009. And this includes sarcoma groups from across the world. And their objectives are to identify problems and challenges across access issues, and unmet medical needs in sarcomas. And they also are looking to find solutions and improve situations by collaborating. And they want to increase visibility of sarcomas with policymakers and the public. So these are two areas that we can tap into as we look at how do we include the patient perspective in an initiative such as this, and be inclusive and touch as many patients as possible so that we can be as inclusive as possible of their collective voice. As an initial step, we conducted a survey of 13 sarcoma advocacy groups in the US that are part of the Sarcoma Coalition. We asked them about their knowledge, their involvement in repurposing initiatives, as well as their willingness to participate in lending their perspective to an initiative. 92% of those surveyed responded. They were all aware of repurposing drugs as a strategy to identify new potential treatments. 11 of the 12 groups responded that they have been involved in funding or in partnering with others to explore potential for drug repurposing, and all of them were interested in providing patient perspective to an initiative for drug repurposing. So as we launch, and as a result of this, we're going to be launching a task force with representatives from across the groups that have expressed interest. An initial meeting will be educational as well as informational, providing the opportunity for the groups to share their experience in repurposing to date. We're intending to capture their successes, the challenges, the opportunities from the patient perspective, with the goal of sharing their collective experience with the team from Cure Drug Repurposing Collaborative, as well as identifying opportunities to further lend insights and guidance from the advocacy community as this program in drug repurposing and sarcoma is further developed. Clearly, the patients have an important perspective to bring to this initiative, and we do have opportunity in a portal for accessing a wide and broad base of sarcoma patients who are clearly interested in lending their perspective. Again, I want to thank you for giving me this opportunity to speak with you today, and I really look forward to our discussion. Thank you.